Hi, I'm Dr. Neal Barnard. During the coronavirus pandemic, we have learned that certain people are at particular risk if they acquire the infection. Those are people who are over 60 or people who have chronic conditions, one of which is diabetes. Now, diabetes was bad enough without the fact that it can make you especially vulnerable to the effects of this virus. Well, let's have a look at diabetes and see how we can tackle that condition so that we're healthier in the face of this virus, but also healthier in general. Now, if you talk to people about diabetes, they might say, well, isn't that the disease that you get from eating sugar? What they mean is that sugar and carbohydrates will increase blood sugar. And so people with diabetes often avoid sugar and starchy foods like bread and potatoes and rice. But if you look at Japan in the 1960s and 70s had the thinnest, healthiest, longest of people on the planet, and they had very, very little diabetes. What were they eating? Well, they were eating rice. Rice was their main dietary staple. Yes, they might have the occasional bit of meat or fish or other foods, but those were really just small flavorings for the rice or noodles that were the mainstay of their diet. If you looked at diabetes prevalence in adults over the age of 40 in Japan, prior to 1980, diabetes was rare, 1 to 5% of the population. But what happened in Japan right around 1980? You guessed it. Burgers arrived. McDonald's and the other fast food chains came into Tokyo and Osaka. People were suddenly eating fried chicken and other unhealthy foods, and by 1990, the prevalence of diabetes was now 11 to 12%. Genetics didn't change during that interval. What changed was diet. Well, who does better? We've learned something from the Adventist Health Study too. You probably know that Seventh-day Adventists have been studied by researchers for a long period of time. They're put under the microscope because, frankly, Adventists are a researcher's dream. It's tens of thousands of people who are non-smoking for the most part, teetotalers, very health conscious, but some of them eat meat, some don't. People follow different kinds of diets, and that allows you to see their effects on health. So in the Adventist Health Study 2, following almost 61,000 people all over the age of 30, it turned out that non-vegetarians, I'm talking about typical meat eaters, had a diabetes prevalence of about 7.6%. Better than the average person, but still fairly high. Then when we looked at semi-vegetarians, these were people who didn't eat meat every day, but maybe less than once a week. Their prevalence was 6.1%. Then pesco-vegetarians, what's that? Pesco fish, right. So you're not eating any meat except for fish. They were down to 4.8%, better, but better still, lacto-ovo-vegetarians, lacto for milk, ovo for eggs. So they're eating milk and eggs and not eating other animal products. They're down to 3.2%, but who does the best? Now, a vegan is not a person from the planet Vegas. That's simply a person who doesn't eat any animal products, and their diabetes prevalence was 2.9%. Compare that to all the other groups. The vegans had the least diabetes. So our research team decided to test out this diet in people who had never done any kind of a vegan diet before and see what happened. We brought in 64 women. They were all overweight. They had all tried every kind of diet, Atkins and South Beach and Nutrisystem and Jenny Craig, you name it, they'd tried it. And they were frustrated because whatever benefits they'd gotten from the diet just didn't last. So we asked them to join one of two groups, and they were assigned at random, either a low-fat vegan diet or a more conventional diet. And we had no calorie limits, no exercise, and they had to provide their own food. So the conventional diet was limiting the amount of meat, reducing fat, but it wasn't a vegetarian or vegan diet. For comparison, the low-fat vegan diet was just what it sounds like. It was no animal products, and we kept oils very low. The foods that we asked everyone to favor were embodied in what we're calling the power plate. That's fruits and grains and vegetables and legumes. What are legumes? Beans, peas, lentils, foods that grow in a pod. And when we showed our participants the foods they could eat, I've got to tell you they were surprised because they could eat pancakes. They could have linguine, as long as it wasn't topped with a meat sauce or Alfredo sauce, but oyster mushrooms, artichoke hearts, little marinara sauce, fine. When we bring research participants into a study, we don't just say, here's your diet, come back in 6 months. We actually get together every week and we meet and we work through challenges. And I think it was the 3rd or 4th week of this study that one of the participants came in and said, Dr. Barnard, I found a treat that I can have on your low-fat vegan diet. And she opened up her purse and she pulled out a pack of Twizzlers. Do you know Twizzlers? Those little red twisty things that they sell at the 7-Eleven? It's true. Look at the packet. The ingredients don't have any animal products in them. They are vegan. It's just sugary, starchy, artificially colored junk. And she made sure that all the research participants knew that Twizzlers are unlimited in Dr. Barnard's diet. Anyway, so our low-fat, vegan, Twizzler-fueled participants set off on their path to the unknown. And what we discovered is that after 14 weeks, the people in the vegan group had lost almost 13 pounds, while the comparison group had lost only about 8 pounds. So the vegan diet was clearly better over the short run. But then we tracked everybody for an additional 2 years, and we discovered that the people who had adopted the vegan diet were skinnier at a year than at the beginning, and skinnier at 2 years than at 1 year, while the comparison group had lost weight and then they ended up putting it all back on. So it looks like a completely plant-based diet is actually a great way not just to lose weight, but to keep it off. So you might be thinking, why is that? How is it that a vegan diet could help me lose weight? Because you're eating carbs, you're not counting calories. How does it work? Well, the first reason is really a no-brainer. Everything you're eating is from a plant. It's beans and vegetables and fruits and whole grains, and plants have fiber, and fiber fills you up with effectively no calories. The second thing is that it's low in fat. Remember, we're not adding a lot of grease, and plants themselves are naturally low in fat. And here's why this matters. A gram of fat, no matter where it's from, has 9 calories. 9 calories per gram. But a gram of carbohydrate, wherever it's from, whether it's from bread or rice or even pure sugar, has only 4 calories per gram. So when I get away from those fatty foods, I get away from a lot of unnecessary calories. But there's something else. Your metabolism increases when you follow a plant-based diet. How can that be? Well, we bring the researchers into our laboratory and we're measuring their metabolism. The way we do it is they lie down on a table and we put a plastic shell. So you sort of feel like a space traveler. It goes over your face and your shoulders and it's capturing the carbon dioxide that you're breathing out, and it measures the oxygen that you're breathing in. And with some pretty simple arithmetic, I can tell you how fast your body is burning calories. But it's 6 o'clock in the morning. Your metabolism is really slow. Your body is not burning a lot of calories. But then I give you breakfast. Now, in our research studies, it's a liquid breakfast. We know exactly what's in it. And everybody's metabolism rises. It always rises after breakfast because your body is absorbing the nutrients in it to start burning things a little bit more quickly. Then you go to a totally plant-based diet. You follow it for another 14 weeks or so. You come back in. You lie down on the very same table. I put the very same shield over your face, and I'm measuring once again your metabolism. But what I discover, your metabolism is not the same. It's faster, roughly 15% faster for 3, 4, 5 hours even after the meal. Now, that's not much. It's just a small change. But it's after breakfast and after lunch and after dinner and even after snacks. You're burning calories a little bit more like you did when you were 14 years old. Your metabolism is speeding up. Getting rid of unwanted weight is a great thing for anybody. But if you have diabetes, it also means that your diabetes is likely to improve. So back in 2003, the National Institutes of Health gave our research team a grant to try to find a better diet for type 2 diabetes. What we did is we compared a conventional diabetes diet that was based on counting calories and limiting carbohydrates. We compared that to a completely plant-based diet. Now, the conventional diet meant limiting calories, carbohydrate fairly steady, don't eat too much bad fat. But the plant-based diet was completely vegan, no animal products. It kept oils very low. And one other thing, we favored what I'm going to call low GI foods, low glycemic index foods. What that means is, let's say I take some white bread. That will make my blood sugar rise pretty quickly. But if instead I have rye bread, the effect on my blood sugar is more gentle. It doesn't rise so quickly. If I have pumpernickel bread, the rise in my blood sugar is even more gentle. If I had beans, more gentle still. So the rye bread or pumpernickel those are more of a low GI food compared to the white bread, which is high GI, high glycemic index. Got it? So vegan, low fat, and favor the healthier carbohydrates. And to cut to the chase, the test that we look at to see how people do with diabetes, it's called A1C, or hemoglobin A1C. It's just a measure of your blood sugar control, and if you have diabetes, I'd like to see it below about 7. At the beginning, our participants were not below 7. They were on average right around 8. And the red line on this graph is the control group, the people on the conventional diet. They did well. Their A1C dropped about 0.4 absolute percentage points. That's good. That's what a medication might do. But that blue line, those are the people on the vegan diet. Look what happened. They had a drop of about 1.2 absolute percentage points. That is huge. If you had a medication that did that, invest. That is a great medication. But this is called asparagus, beans, and it's simply the effect of a healthy vegan diet. So how does that work? Okay, let me show you what causes type 2 diabetes. This is very, very important. If you're watching this with just half an eye, let me have your full attention for just the next couple of minutes. This big blue oval, that's a cell, one of the cells in your body. And your cells are powered by sugar, glucose. Glucose is a natural sugar that goes through those funny little purple channels into the cell, and the glucose gives them fuel, it gives them energy. But your muscle cells, your liver cells, they can't get the glucose into the cell at all without a key, and the key is called insulin. Insulin is made in your pancreas. It's a hormone. It goes into your bloodstream, it arrives at the cell, and it acts just like a key. It opens up the cell to let the glucose inside. Specifically, when the insulin arrives you see those red receptors there? Once the key arrives into the receptor, just like a key in a lock, it's now opening up those purple channels, and there's the glucose coming right inside. If you've got type 2 diabetes, you've got glucose trying to get into the cell, you've got insulin trying to let it in, what's gone wrong? The problem is inside the cell. You see those yellow blobs? That's beef fat, chicken fat, pork fat, corn oil, olive oil, extra virgin olive oil, extra virgin olive oil. Maybe there's some 1040 motor oil in there. I'm not sure. That's unhealthy grease that's packing up the cell, and now the insulin key can't work because the cell is gummed up with fat. I'm speaking a little simply, but it's by analogy very much like if you arrived home and somebody had put chewing gum in your front door lock. There's nothing wrong with your key, but it's never going to open up that lock until we clean it out. Your cells aren't filled with chewing gum, they're filled with fat. Now, doctors hate words like fat. It's only got 3 letters. So we're going to call it intramyocellular lipid. Well, now that's a mouthful, isn't it? Intra means inside. Myo means muscle. Myocellular means a muscle cell. And lipid means fat. Intramyocellular lipid is fat inside your muscle cells that's making your insulin not work. And that causes a condition called insulin resistance. The muscle cell is not behaving. It can't respond to insulin. So what do? On a low-fat vegan diet, how much animal fat is there? None, right? And if I keep the oils low, what happens is the fat starts to drain out of that cell. It dissipates, it goes away, and now the insulin can start working again, like it did when you were younger. Researchers at Yale University did a fascinating study. They brought in 26 healthy volunteers, and they gave them a glucose tolerance test. Did you ever have that test? You drink 75 grams of a syrupy solution, and then we track your blood sugar over the next couple of hours. And some of the participants were what we call insulin sensitive, meaning when they drank this sugary solution, their blood sugar went up, but it quickly went right back down because the insulin was able to tuck the sugar into their cells. They're insulin sensitive. But there were others who were insulin resistant, meaning when they took in that sugary solution, the sugar was in their blood, but it couldn't get into the cells where it belongs because maybe something was gummed up inside their cells. They were insulin resistant. So let's look at their age. They're young people, 28 and 26 years of age in the 2 groups. And look, they were thin, 132 pounds, 141 pounds. And if you look at their hemoglobin A1Cs, This will not be on the test, but those are normal numbers. These people didn't have diabetes or prediabetes. They were healthy. However, then everybody went into a scanning device. The technique is called magnetic resonance spectroscopy. And now what we're doing is we're looking inside the cells of the body, and what we see is frightening. Here's the data. Every dot here is an individual. And if you look at the control subjects, in other words, those who were insulin sensitive, they had relatively low levels of intramyocellular lipid. They didn't have much fat in their cells. But look at the insulin-resistant participants. They had much more fat in their cells. And now we look at something else. Do you remember mitochondria from your high school biology? Those are the burners inside your cells. In the control subjects, their mitochondria, they were active, they were burning fuels as they should. And in the insulin-resistant participants, their mitochondrial activity was shut down. It was lower, meaning the cells were sluggish. They weren't doing what they're supposed to. So here's what is happening. These were young, healthy people. But fatty foods that they were eating were packing fat into their cells, making them insulin resistant. So even though they were young and they didn't have diabetes yet, if they were insulin resistant now, because of the fat building up in their cells, that predicts that they are going to have diabetes later on, maybe 15 years, 20 years down the road. It starts when you're young. So what's our prescription? No animal products, minimize the oils, favor the low GI foods. Now, I know what you might be thinking, that people imagine that on a plant-based diet, it's hard to know if there's protein in it. Well, it turns out that there's lots of protein in plant foods. Beans, grains, vegetables have more than enough protein, even for athletes. Calcium? Do you need milk for calcium? The answer is no. Cows actually don't make calcium. They get calcium that came from the earth into the roots of grass, and when they ate the grass, the calcium that had originally come out of the earth now ends up in their bodies, in their milk. And if you drink milk, you'll get some calcium, but you only absorb about 32% of it. Instead, have green leafy vegetables yourself. Hopefully not grass, but broccoli and collards and kale, great sources. Vitamin B12 is something that you should have. You need it for healthy nerves and healthy blood, and it's not made by animals or plants. It's really made by bacteria. And some people speculate that over the millennia in the past, the traces of bacteria on our soil or on our vegetables or maybe even on our fingers or in our mouths would create traces of B12. Well, that's certainly not the case today, if it ever was. Take a supplement. Go to the drugstore, the health food store, you'll see vitamin B12 pills there. Get the smallest one that they have and you'll be set. It's also in every multiple vitamin that you ever took. Now, there are a few special considerations that I want to mention. One is hypoglycemia, low blood sugar. I can hear what you're thinking. I've got diabetes. I've got high blood sugar. How could I ever have low blood sugar? Here's why. If you're using insulin or any of the sulfonylurea drugs, they are designed to bring your blood sugar down. But now you're switching your diet to a healthy, low-fat, completely vegan diet that also brings your blood sugar down. The combination can end up being too much for you. So let your doctor know that you're about to start a healthy diet, and your doctor can ratchet you back on the insulin or other medications that you may be taking when the time is right. Don't do this on your own. The second thing is hypotension. What's that? Low blood sugar. I can imagine what you're saying. Wait a minute, I've got high blood sugar. And you might even be taking medications for it. That's exactly the issue. When you're on a healthy plant-based diet, it's loaded with potassium, that's in vegetables, and that lowers your blood pressure a little bit. Also, when people go on a vegan diet, they tend to lose weight, and that lowers your blood pressure too. And so if you're still on all the same old medications, your blood pressure at some point can get kind of low. So you're sitting at a table, you stand up a little too fast, and you get woozy because your blood pressure is now low. Don't throw your medications away. Instead, just let your doctor know that you're changing your diet, and your doctor can ratchet you off your medications if and when the time is right. One more special consideration, and that's an anticoagulant medication that you might be using. It's called warfarin or Coumadin. And some doctors in the past would say, don't eat a lot of vegetables while you're on this medication because the vegetables have vitamin K that will counteract the effect of the anticoagulant. But of course, people want to have vegetables because vegetables are really healthy for them. Here's the answer. Eat lots of vegetables, but keep the amount fairly constant from day to day. If it doesn't vary a whole lot, then the doctor can find the right dose of your anticoagulant and things will be fine. And of course, nowadays, a lot of doctors are using more modern medications and they discover that there isn't any issue about their diet at all. So there you have it. We always want to get diabetes under better control, improve it, or even get rid of it if we can, and a low-fat, plant-based diet is the best way to get you there.